ECT or electroconvulsive therapy could help kind of progress your treatment, because I know you've been here a really long time and Alana's tried a lot of medicines.
I think I should progress my treatment. I think I'm confident enough to have friends that build my confidence. I don't need to feel ashamed of anything like that.
No?
But ECT therapy sounds good.
What's that?
ECT therapy sounds good.
It sounds good? Okay. All right. So has everyone read a little bit about ECT? Would it be helpful for me to give kind of an overview of the procedure?
Yeah, please. Yeah.
Okay. Okay, sure. So ECT is a treatment that's been around for a really long time, since like the 1930s, and it's come a long way from like the way that things used to be done. Used to be kind of a scary and like traumatic experience for folks, which is not the case anymore with modern medicine. So this is a treatment that we use for certain psychiatric disorders, including depression, bipolar disorder, and some types of psychotic disorders, and also a group of symptoms including catatonia and NMS, which can come with certain psychiatric disorders.
You're okay, man. We'll get your phone after, okay?
Have you settled on a diagnosis with Van? Or?
So right now, so I know that Van has had like a long history of depressive symptoms. When she first came in, she demonstrated like some manic symptoms with you know, increased energy, decreasing need for sleep for days, also along with pressured speech, and her ideas were just kind of floating back and forth and not really connecting, like racing thoughts. And she, you know, so she demonstrated like, and also she had auditory hallucinations, paranoia, you know, so again, with that type of symptoms, it does look like she does present with bipolar disorder with psychotic features with that, but again, depending, this is such an acute phase, that diagnosis may change with months from now with monitoring and everything, but that's what it does present right now.
Yeah, so I've looked at your chart pretty extensively, independent of you know, what Alana says, and I've met with you, and I actually agree with that diagnosis. So ECT, like I said, can be helpful to stabilize your mood, can also help work with your medications, you know, to get you feeling better, and to help your thoughts kind of get you know, back to reality. And at one point, Alana was concerned that you had some catatonic type features. And ECT is also really helpful for that as well.
I think it's really awesome because every time I try to touch my family, I want to say, oh, they're coming at 1. And then say, okay, I'll go to sleep. So I'm going to sleep, I'm going at 5. So I'm always like, oh, they're coming at 6:30. I know they can, oh, they're coming at 7:30. It's really, really hard for me.
Yeah.
To get back to it with that constantly.
It is hard. So that's kind of just like an oversight of why we might give someone ECT. It's not usually a treatment that we jump to as our first line. Like we'll usually try, you know, therapy if a person can kind of you know, stay out in the community, you know, then add medications, and it sounds like you've been going along with those things, and it hasn't totally cut it. I know Van's been in the hospital for a really long time, and just like all of the